day everyone. I'm going to be briefing about hepatitis shortly. Hepatitis is the inflammation of the liver that is basically caused by a viral infection. Apart from being caused by a viral infection, there are some triggers for hepatitis. Number one is alcohol abuse. When you take too much of alcohol, it can pose problem to the liver, causing its inflammation. And also, certain medications like excess intake or excess consumption of paracetamol, non-steroidal anti-inflammatory drugs like your ibuprofen can also pose problem to your liver as well. And also, we also have autoimmune disorders like the celiac disease that affect the intestines, and also have the Graves' disease that affects the thyroid gland, causing hypersecretion or hyposecretion. That's why we come about hyperthyroidism and hypothyroidism. Also have myasthenia gravis. This causes weakness of the muscle. So it's an autoimmune disorder that affects the muscle, causing it to easily fall weaken in case there's a problem. And also we have another autoimmune disorder that can also affect or cause problem leading to hepatitis, which is called type 1 diabetes. Type 1 diabetes is a type of diabetes in which the pancreatic beta cells of the pancreas is damaged. You know that the pancreatic beta cells are what is responsible for the production or secretion of insulin and glucagon. So at this particular point, the pancreatic beta cells are completely damaged, thereby leading to type 1 diabetes. I told you earlier that hepatitis is caused by a viral infection. So the major cause of hepatitis is a viral infection. Symptoms of hepatitis, number one, jaundice. If somebody have hepatitis, you discover that the person is going to be having yellow discoloration of the skin or of the sclera of the eyes. If you can see my eyes, the white part of my eyes is called the sclera. So if somebody is having hepatitis, the white part is going to be looking yellowish. Number two thing or symptoms of somebody that have hepatitis is that when you have hepatitis, when you go to urinate or micturate in the bathroom or in the restroom, you discover that the color of your urine is dark. So when you urinate dark urine, just know that hepatitis symptom is also one of it. Then abdominal pain. Some people have hepatitis, they'll have abdominal pain. Some people also have hepatitis, they'll be feeling nauseous, and even some people also vomit too. We also have types of hepatitis. Number one, we have type A hepatitis. We also have hepatitis B, okay, and also have the hepatitis C. Now in hepatitis A, this is very common. It's very common because most of us, we end up having hepatitis A easily. Why? Because you can contract it when you eat contaminated food or drinks. So for those of you that like eating outside, you don't know how the food is being processed, you need to take time and be very careful. Limit the way you eat outside so that you don't end up contracting hepatitis A. Then the second type of this hepatitis is the hepatitis B, which is commonly transmitted through blood and bodily fluids like the sweat. So avoid exchanging clothes with your partner or with your colleague, especially when your partner have hepatitis and your partner sweats on that particular clothes. Avoid it. You can contract hepatitis through bodily fluid like the sweat. So imagine you have your roommate and both of you sleep on the same bed, and you both of you sleep on the same bed and you sweat on the same bed. So anyone who has the hepatitis can transmit it to the other person. So hepatitis B is very common. It's a viral infection. It's a sexually transmitted infection as well, which simply means that it can be transferred through sex. Most times hepatitis B is not pronounced like HIV, but it can be transmitted through sexual intercourse. So we have management. Okay, there's something we call preventive vaccine for hepatitis. Now, before you take your preventive vaccine for hepatitis, it simply means that you don't have the hepatitis, you've done your test in the lab, your test is presented negative. So you can go ahead to the hospital and take your hepatitis vaccine to prevent yourself in case you get exposed to somebody who have the hepatitis. Hepatitis vaccine comes in 3 phases. We have the first dose, the second dose, and the third dose. So if you're taking your hepatitis vaccine, it simply means that when you go for the first time, that's your first dose, and you come back after a month for your second dose, and you come back again after another month for your third dose. So it takes 3 months to complete your hepatitis vaccination. So please try as much as possible. If you have not taken your vaccine for your hepatitis, or you've not taken preventive vaccine for hepatitis, go and take it so that we can limit the spread of hepatitis to people who have it. Thank you so much. I hope to see you in my next video.